I hope that's the case. You are listening to 97.5 The Fanatic, WPN, Burlington, Philadelphia, broadcasting from the Xfinity studio, only from Comcast. To help us understand this a little further and how this all comes together with Deshaun Jackson, we have from Rothman, we have Dr. TJ. Now, Dr. TJ, is it Dr. Tjoumakaris? Am I saying that right?
Yeah, that's pretty close.
Close enough.
It's a long Greek name, guys.
Hey, I appreciate that, man. I appreciate you coming on with us today. So we're trying to figure out how all this works. Now, it's no longer termed a sports hernia. It's a abdominal core injury. What exactly does that mean?
So your core is essentially your abdominal muscles and also your hip muscles. So basically the muscles that help move you in a twisting or side-to-side motion. In orthopedics, we even term this even more broadly and say athletic pubalgia, which basically is any kind of soreness or pain that develops in and around the pelvis or groin.
Oh, wow. Okay. Now, this was something that they were trying to treat with just rehab over the course of 6 weeks. I know you're not treating Deshaun Jackson, but does that sound like something that could be rehabbed in that short amount of time?
Well, that is the recommended standard of care for a lot of people who present with athletic pubalgia or groin or core injuries is essentially a period of rest, a couple of weeks. As the pain subsides from the rest, then you slowly get back to a gradual return of activities like normal daily activities, and then a physical therapy core strengthening program to see if guys can get back to some semblance of physical activity. If they pass that, then ultimately you're saying, all right, let's give you kind of a gradual return to play, see how it goes, either with practice, and then from there, maybe even gameplay. So I think that progression is not atypical at all. And then you basically see how people perform. If it's tough, then you either do one of two things. You start over if they can't get to it by 6 weeks or so, or you think about other options, whether it be surgical or other treatment options.
Speaking with Dr. TJ from Rothman. So looking at Deshaun Jackson, they go through the rehab of 6 weeks. He comes back for about 4 plays and gets some contact, gets tackled in one instance where he was actually interfered with and there was a penalty called, and then there was another instance where he was pushed out of bounds in the end zone. So is contact something that could strain it further?
Well, it's you're using these abdominal muscles and these core muscles pretty much all the time, especially in sports like hockey, football, soccer, gymnastics. As anytime you're twisting or trying to course correct your body in a twisting motion, these muscles are prone to being strained or utilized. And so if you have an injury to them, it's very common for them to be re-aggravated by kind of trying to avoid getting hit, avoid going out of bounds, or twisting yourself to maybe get that extra yard.
Doctors, we've heard that sometimes recovery is better if you let it heal on its own because the muscle will grow stronger back onto the bone. Is that a true statement there?
Well, it really kind of depends upon your injury. There are MRI protocols that can look specifically at the muscle and look at the tendon attachment to bone because, muscle starts out as this broad, fleshy mass of tissue, and then it goes into this tendon, which is more thick and I would call it like fibrotic, like almost like rope-like, and then it attaches to bone. The muscles in your abdominal wall don't really have that thick tendon like they do in other parts of your body. So if it's just a small little tendon injury at the bone, then you can obviously get good healing. But if it's a much broader injury, then it may be very tough to heal. So I don't know that necessarily you get stronger by doing non-operative care. I think it really depends on where the muscle is injured, how long that particular injury might take to heal, and just the progress of the athlete and how they feel. And certainly position is going to affect it. Guys that don't do as much twisting or turning or sudden decelerating movements aren't going to have as much issue with an abdominal or core muscle injury as somebody who has to do that kind of on a repetitive basis, like a skilled position player.
So as operative care, would it be more definitive? Like, we're using Deshaun Jackson, obviously, but in anything, if somebody had this, it's kind of vague from what you're describing about how they could just rehab. Although, if they had the surgery, is that more definitive? Could you have said back then, 6 to 8 weeks, you should be fine?
Well, it depends, right? So, I think you're always, as a physician, trying to do what's safest and best for the athlete. Surgery doesn't come without risk, and not every surgery is successful. The best done surgeries, and whether it be in orthopedics or other sports kind of surgeries, have about 93% success rate. So that's 7 out of 100 people that aren't going to do as well as you'd like or maybe fail an operation. So surgery is not perfect either. So I think you're always trying to get what's safest for the athlete, seeing if they can heal the injury naturally, going through their natural progressions. And then if they can't, then you have to consider kind of more of a worse alternative. Now, there's other injuries like you tear your ACL and you're a skilled player. You know you need that
Sure.
to compete. So it's a little bit different with this type of injury because, like you said earlier, there is an opportunity for this to heal. And so you want to give the body a chance to naturally heal. It's just unfortunate timing of the season for certain athletes. When it happens, they have to miss game time. And making these decisions can be really tough in season. So I got a lot of respect for the guys who have to make those decisions.
Sure. Speaking with Dr. TJ from Rothman, do you watch this from a doctor's and sports fan perspective, Doctor? Like when a player says he's going to opt not to have surgery and he's just going to try to rehab it, are you, like, as a fan, are you going, no, just have the surgery? Or, yeah, I can totally see you just rehabbing it?
Yeah, I mean, these are really nuanced discussions. I think sometimes when you're watching it casually as a fan, you don't really know like what the exact injury is, right? Like you don't have the MRI to look at, you don't have all those issues, and you're not having an athlete. You know, it's really easy to say, oh, I would do this X, Y, Z, but then you're sitting in front of a patient, talking to them, talking to their family, talking to their coaches, and trying to determine what's the best plan. And it's a lot harder at that point because now you have all the information in front of you, and then making these decisions from game to game. You know, the athlete wants to play a lot of times. They want to get back as quickly as possible. And surgery, if they have surgery right away, you know they're going to be out maybe 6, 8, maybe even 10 weeks. So you know that's going to be a huge time commitment. But you also know, well, if they don't have surgery and they ultimately need it, that's also, you know, so you play the odds and you say, well, look, here's what's likely to happen. Chances are you could rehab this, do well, and you could salvage this season. So I think you have these discussions, and it's very challenging. So I don't always sit here and play armchair quarterback with these guys because I think it's really tough when you're actually taking care of those athletes to make the best decisions for them.
Now, Matt Collins, wide receiver for the Eagles, missed an entire year with a groin strain is basically what it came down to. Zach Ertz, I think, had more success when he did have surgery, and he came back from it fine. With this case with Deshaun Jackson, really what is what makes it more serious? What makes it less serious? What makes it something that you know you can rehabilitate? What makes it something that you should have the surgery?
So it's really response to treatment. I think that ultimately, and again, I'm not caring for Deshaun Jackson. I'm not his provider or anything, but I think it's really how they respond to initial treatment. Like if an athlete comes back to us in a week or 2 weeks and says, "Hey, I feel great. Like I really think I'm feeling pretty good," and you have this MRI that says, "Well, there's this abdominal strain. There's maybe a tendon injury." You say, all right, well, let's give it some time. You rehab it. So a lot of times you're going by the athlete's feedback, how he feels, how he's rehabilitating. You're talking to the athletic trainers, the physical therapists, and saying, how's this guy progressing? You're seeing them back almost weekly in the training room on a weekly basis to see how he's feeling. And so you're optimistic on their recovery initially. So, and then as they get back, you say, all right, let's see now. Because, as you guys know, gameplay is much different. Like what happens in practice, especially once you get to midseason, and what happens during the game, that speed is so much different in terms of going from a Wednesday to a Sunday and what these guys are doing. So it really can change on a dime and how they feel once they get back to playing. So a lot of times you don't know, and you're really just going by the feedback. Because even if somebody has an MRI or a study that shows a lot of fluid or strain, you're still going to go by how that athlete feels.
All right.
So it's always about the feel.
All right, Dr. TJ, you have surgery in a little bit?
I do.
Look at this man. I'll just call the radio station. Weigh in right here.
Absolutely.
Let me try one more.
What's going on now, guys? I do have a little bit of time.
Oh, wait, hold on. Can you please call us during the surgery?
What kind of surgery are you doing?
All kinds of stuff. We're fixing knees. We're fixing biceps today, shoulders, a lot of different stuff.
Wow.
And some
Awesome.
hip stuff, too.
Exactly. And
So it's kind of a
Rothman,
good mix.
yeah, and Rothman, they do same-day joint. You qualify, boom, you're back in your bed that night. Not too bad, huh?
Mm-hmm.
How about that? Dr. TJ, great catching up with you as always. Thanks so much for shedding some light on the Deshaun Jackson issue.
All right, guys. Thanks a lot.
Thanks very
Doctor.
much. Dr. TJ, I believe it's Dr. Tjoumakaris.